Hello and good evening to all of you. So, we will be doing the first part of ANC and maternal medicine today. 6 stations, okay? And um, the history template is overlapping in these stations. Well, it is also a very vast module, but you can see that you can apply the history template everywhere. The only thing is that regarding some medical conditions, you should know the management. Like there was this multiple sclerosis station, which was new this time. And there is a sarcoidosis talk. So there can be structured discussion or even simulated patient task on that. So like the management part uh, is the one on which we people have to work hard. Otherwise, history taking is nearly same. And yes, if you're in the preconception clinic and you then please concentrate mainly on the preconception counseling. Please don't rush to cover antenatal, intrapartum, or postpartum care. Well, if you are able to finish the preconception, then you will just be able to finish the antenatal part, because the time is very short. So concentrate on the preconception part. You have to see condition is optimized or not, whether she's on any birth control method, what type of method is she taking, whether she is following up with her specialist doctor. The folic acid dose is important. BMI is also important. So you have to concentrate on these things. And I always say never rush in any station in the exam. Never try to finish your station in never think that you have to finish your station in 10 minutes. So you have to go on talking. You have to take the pause in between. Give the information in chunks. Ask her whether she knows about a condition. If she knows about it, how much she knows about it. Okay, so would you like me to explain a little bit more about your condition? If she says no, then no need to explain, no need to waste your time. Uh, then you can seek her permission and go and discuss the management plan. Okay, so it is always the role players agenda which you have to follow in the exam. All right, so we now, who will come first today? Shweta, as usual, would you like to present first?
Yes, ma'am. I'll try.
Okay, right, all right. After Shweta, someone has to be ready, okay? So that we don't waste time. Okay, okay, my dear, 2 slides for you.
Yes. Yes. Next.
Yes.
Yeah. Can I start?
Yes, if you're ready, you can start.
Yeah. Uh, Previous slide.
Yes.
Previous one.
Mhm.
Yeah. Hello, I'm Dr. Sweta, one of the doctor in preconception clinic today. Am I talking to Winnie Simpson, 35 years old?
Yes.
Can I call you Winnie?
Yes.
Okay. Winnie, I understand that you are here because you want to discuss about your future pregnancy, and you have one baby with cystic fibrosis. Is it so?
Yes.
So I'm really sorry to know about your baby, Winnie. Next slide, ma'am.
Yes.
I'm really sorry to know about your baby. So may I know when about your baby in your own words?
Oh, yes, my baby is having the condition which is cystic fibrosis. And, he is
Mhm.
having repeated chest infections, and like he's under the care of the physicians. And off and on, like he has to take a lot of medications. And my baby's condition has, it's so much of, it's very sad to see my baby in that condition. And my partner and me, we are planning to have another baby. But I don't
Mhm.
want my other baby to have the same condition.
Yes, I can understand your situation, Winnie. Actually, you must have gone through a lot. And I understand that having a baby with cystic fibrosis and taking care of him is a difficult task. So, have you, are you in touch with any support group, cystic fibrosis support group, or in touch with counselor?
Yes, yes, yes. We are in touch with them.
Okay, good to know that. So, Winnie, I know that how is baby doing?
Yes, like he's not so well actually. As I told you, he's having repeated infections.
Yes, I'm really sorry about that. So, Winnie, may I know about any previous pregnancy you have other than this baby?
No, no, I only had this was my first pregnancy actually.
Yeah, and any other? May I know about your periods? Is it
Yeah,
regular?
yes, yes, they are regular.
And when is the last one? Last date of
Yeah, I
period?
think that was 10 days ago. Today's the 10th day. Yeah.
Are you taking any contraception?
My partner is using condoms.
Okay. Winnie, may I know about any medical illness other than you have?
No, no,
Okay. Any chest pain, cough, breathlessness you have?
no, no,
Any tummy problem, like any bowel problem and
no,
any diabetes?
no, no,
Okay. So, any surgery done in the past?
no,
Are you allergic to anything?
no,
Any medicine for any other reason?
no, no.
Okay. So, do you smoke?
Well, I'm trying to quit smoking.
Hmm. Good to know that. So, reducing smoking and stopping is very important for carrying normal pregnancy and for your health as well.
Hmm,
Okay, Winnie.
yes.
So, pardon me to ask any alcohol and recreational drug?
No, no.
And what's your height weight ratio?
Yes, it is 24.
Mhm. Yeah. So, how is the support at home?
Yes, my partner is supportive.
Yeah, good to know that. So, any cystic fibrosis, like, or any other genetic disease running in your family?
Mm, yes, I think my maternal uncle has also the same condition.
Oh, so sorry to know that. How is it doing?
Yeah, he's also coping somehow. He's also having same repeated chest infections.
Okay, good to know that. So, Winnie, may I know your blood group?
A positive.
Okay. So, Winnie, I understand that your you and your partner have been tested for genetic condition for cystic fibrosis,
Yes,
and you have been found carrier for it.
yes,
Am I right?
yes, yes.
Okay. So, Winnie, what do you know about this cystic fibrosis? Can you let me know?
Yes, my GP and my doctor, he told me that it is a genetic condition. My baby can have the condition, and since we are carriers,
Yes.
so we are not at risk of having any condition.
Yes, yes, Vinny, we all are here to support you. And so regarding the condition of cystic fibrosis, yes, you told right that it is a genetic condition. So genetic condition is inherited condition. It is like we inherit from our parents and from in family and pass over to children.
Yes,
So yes, as you and your partner have been tested for cystic fibrosis gene, and both were positive. So, this causes your baby to have problem. Am I clear so far?
Okay, yes.
So whenever this condition happens and both of partner are carrier for cystic fibrosis gene, what happens that 1 in 4 chances that having a baby with a normal, and 1 in 4 chances of having baby with affected, okay, and 1 in 2 chances that baby would be carrying the gene like you and your partner.
Yeah, so
So for that, yes,
how
yes,
we
Vinny?
will, yeah, how will we will come to know about it, whether my baby is having the
Yes.
condition or not?
Yes, definitely. I'll come to that. So I'll refer you to genetic counselor for that, and for your and also a team of specialists would be taking care of you. Okay. So and there are some tests like which can be done before the pregnancy as well as during the pregnancy. So a team of specialists would be involved in this. Okay, they will be guiding you, like my consultant obstetrician, genetic counselor, geneticist, and then fetal specialized doctor called fetal medicine unit. All
Yes.
specialist nurse, all would be involved in your care. So regarding the knowing the condition before the pregnancy, we call it a test is there. We call it pre-implantation genetic testing. So what happens in that it is a like a IVF, like a test tube baby. Are you aware of test tube baby?
Oh, yes, I know.
Okay, so what is done that like a embryo is formed in the lab from sperm and egg from you and your partner, and then that is tested. The cell from that is tested under microscope to see that any genetic gene of the cystic fibrosis is there or not. And only healthy cells are only healthy embryo is implanted back into the womb. So, however, this condition is not also 100% sure. Are you with me?
Yes, okay.
And there are some tests also during the pregnancy as well. We call it NIPT, where this is the non-invasive, like it is tested with mother's blood. It is done from after the 9 to 10 weeks of pregnancy. A blood from mother is tested because babies, some blood are found in mother blood as well. So this blood cells is tested under microscope in the lab to see that the gene is there or not. So, however, this is a screening test. This is not a diagnostic test. So, if it comes to be positive, then there are some diagnostic tests that is done in the specialized clinic called fetal medicine unit. Are you following me?
Okay, yes.
So in fetal medicine unit, what do they do? That they do the needle testing. Needle testing is that they put a needle through the tummy after proper precaution, and then they take. There are two methods. One is that they take tissue sample from the afterbirth, and that is done after between the 11 to 15 weeks. And another is amniocentesis, we call it in medical terms. So here the fluid from your uh, uh, around the baby's body is taken, and that is tested under microscope. We call it amniocentesis. So this one is, these two are confirmatory test. So
Mhm.
after that, however, there are some risk associated with that also, like risk of miscarriage is there, like 1 in 200 cases miscarriage can happen, and also there are risk of infection with this also. But if it is done with the expert hand, then the chances are less.
Okay.
Am I making sense to you?
Yes, yes. All right.
Okay, so these are the tests, and I'll give you the patient information leaflet about the cystic fibrosis gene as well as the procedure as well, and you can come with your partner as well. We'll discuss together, and I'll refer you to the genetic counselor and fertility specialist also, and regarding the discussion for further
Right.
test and
Okay.
advice. Okay,
Okay. Yeah.
okay,
Okay.
okay. Any other concern, Vinny?
No, no, no. Thank
So
you.
till then, you advise contraception till okay,
Yes.
whenever
Okay.
you
Time is up.
and start folic acid tablet
Right.
before.
Okay. Okay. Thank you. Well done. So this was all about your preconception counseling, talking about all the tests. So your time will be consumed in that only. It is very difficult to talk
Yeah,
about
how much time I took in
counseling part.
this test?
You started when you had 5 minutes. So it was nice. Your aim and agenda you finished in 4 minutes. 4 minutes, few seconds. And 5 minutes you had.
And in total, whole in total?
10 minutes, 10 minutes. You finished on time, just on
Okay.
time. Yeah.
Okay. Okay.
Yes,
Take
good.
care of that.
So, yes, actually, I have to make one correction in this, even in my recording.
Yes.
When I was going through it, actually, what is there that there are two tests. One is NIPT. T is the test which is mainly we do for the trisomies. So, Down syndrome, Adverse, and Patau syndrome. So that is not diagnostic. Okay, we know if NIPT comes as a high risk, we are doing the needle test. All right. Now there is another one, NIPD, non-invasive prenatal diagnosis. Okay, so here for single gene conditions and to determine the sex of the baby, we are doing the NIPD, non-invasive prenatal diagnostic test. So this diagnostic test helps to confirm the diagnosis. It is non-invasive test, but may or may not be funded by the NHS. Patient have to bear the cost herself. So and also this will be done during the pregnancy by 10 weeks, isn't it? 9 to 10 weeks. Needle test, then you are going to talk about the needle test. So I will change that recording of the cystic fibrosis gene because I know there is something wrong. I mean, the information is little wrong. So it is NIPD. Are you getting me? All of you? What I want
Yes,
to
NIPD. Yeah.
T
Uh,
T is for the
so
diagnosis. Yes, my dear.
okay. So this is for cystic fibrosis gene, like
Yes,
blood test we do for
yes.
mutation.
Exactly.
Okay.
NIPD, they are doing for the single gene conditions, cystic fibrosis gene, some muscular dystrophy, Duchenne
Yes.
dystrophy, they are
Now
doing
I
it,
got that.
some single gene mutations to confirm the sex of the baby also. So they are doing it. And so this will be NIPD, diagnostic test, not NIPT. That was the confusion. So I will change that recording also. I'll do it in a day or two because that is okay. And after this, I will also discuss about a case where the patient has twins and previous baby with cystic fibrosis. Okay, so we can just have a short discussion on that. All right, so well done. Information gathering part was absolutely fine. You asked about whether we are in touch with the support groups and counselors, so good. So you will not repeat that. Well done. Communication with patient, I was feeling very comfortable. Colleagues, you all involved all of them, genetic counselors, fetal medicine specialists, they are the important ones. Applied clinical knowledge, patient safety is absolutely fine. Just change the word uh, testing to diagnosis. Okay, we will see how to do that. All right, so you are in the preconception clinic. Hello, I'm Dr. Shweta, one of the doctors in the preconception clinic today. May I confirm your name and age, please? How may I address you? Thank you, Winnie. I understand you have been referred by your GP as you're planning for pregnancy and you also have some concerns to discuss. So, can you tell me more about your concerns? If she tells about a baby in the very beginning, of course, you have to be empathetic. I'm sorry to hear about that. May I know the name of your child? I can see you are really going through a tough time. And how's your son doing now? How are you coping? And if she has a lot of concerns, yes, few sentences you can say, yes, your concerns are understandable. And in a moment, I'll try to address all your concerns. So before addressing the concerns, is it okay if I ask you a few questions and then discuss about the tests and the further management plan? Will that be okay? I will be giving the written information leaflet about your condition and about the tests which we are going to discuss and write back to the GP about our mutually agreed care plan if GP letter is given. If no GP letter, you don't have to say that in all the station. All right, so and feel free to ask any question at any time. So I can see that you and your partner are carriers of cystic fibrosis gene. So can you tell me how you were diagnosed with this gene? And do you have any cough, chest pain, bowel opening, any tummy upset, any hospital admission? May I know when was your last period and how are your periods otherwise? Are you updated with the cervical screening? Are you on any birth control method? Have you ever been pregnant before? Can you tell me more about your previous pregnancy and delivery so that this was the only first pregnancy? And are you following GP for any medical condition? Are you on any medication? Have you started taking folic acid? Any sort of allergy? May I know, are you immune to infection known as rubella? You can ask that here, or you can counsel it in the end that we have to give the folic acid and also arrange some test for the rubella before you embark on next pregnancy. Any surgery on a tummy or down below, any family history of similar condition or any other genetic condition. And may I know what you do for a living? Whom are you living with? Is your partner supportive? Do you smoke cigarettes, drink alcohol? Pardon me to ask, any recreational drug? So if you're a smoker or alcohol, you have to offer referral to NHS Stop Smoking and Stop Alcohol Services. Have you been feeling low or down lately? And are you in touch with the counselors? Okay, she's already in touch with the counselors. That's fine. May I know your weight height ratio? I can see it is 24, your blood group. Thanks for these informations. Would you like to add anything important? Now, coming to your concerns, do you have any idea about the condition cystic fibrosis? May I know what you know about this condition? Okay, yes, you are right. It is a genetic condition. It runs in family, and the baby can also be affected if the parents are having this condition. So, would you like me to tell more about it? So, little bit more, you can say that regarding the cure, it cannot be cured completely. Treatments are available to help reduce the problems caused by this condition and help to improve the quality of life, but expectancy is shortened with this condition. All right. So, do you have idea about the inheritance, like how your baby can have this condition? So, your child can have the condition if the child inherits the faulty genes from both the parents. And in your case, you and your partner, they both are carriers of the gene. So, there is 1 in 4 chance that your child will not be having this condition. 1 in 4 chance that the child can inherit the genes from both of you and can have condition. 1 in 2 chance child can be a carrier. And usually carriers, they don't have any symptom. They lead a normal healthy life, and those having the condition have symptoms. So we can also refer you to the genetic counselors where you can talk in detail about the inheritance. Will that be okay? Now, regarding your further care and management, it's going to be shared care involving the group of specialists, including my consultant, genetic counselor, the fertility specialist, specialist nurse, and the GP. So now she wants to have a healthy baby, then you have to talk about all the options. So we will offer a specialized test called pre-implantation genetic testing. Have you heard about it? So for this test, we will be referring you to the genetic counselors to get their opinion and then to the fertility specialist. It is a combination of test tube baby and like genetic testing of the developing embryo. So have you heard about this test tube baby, how it is done? So your eggs will be collected and mixed with your partner's sperm in the lab, and resulting embryos, that is babies, will be examined under a microscope to assess for genetic makeup. And only healthy embryo, that is healthy baby, not affected by the condition, will be selected and placed inside your womb. So, and this lab test is not 100% accurate. There is still some chance that less than 1 in 100 chance that affected embryo can be placed inside the womb. So there are some other options also to have a healthy baby, like having healthy donor eggs and donor sperms or adoption as a last resort. And during the pregnancy also we can offer some test. One is it is not a screening test. I will remove this thing, okay? This is the which we call as the non-invasive prenatal diagnostic test, usually done after 9 to 10 weeks of pregnancy. In this, the blood is taken and uh, the mother's blood is taken, and we see the baby's genetic makeup, because you know what happens in normal pregnancy, there is some mixture of the baby's blood in the mother's blood. So We will assess the baby's genetic makeup to see whether the baby is also having this gene or not. The advantage is that there is no risk of miscarriage because we don't have to enter inside the womb. We have other tests which are known as needle test, and they also help to know whether the baby is having this condition or not. This is done under scan guidance by specialist fetal medicine doctors, that is the specialist baby doctors. This will be done in specialized centers. There are of two types. One is done in early pregnancy, in which samples are taken from the afterbirth and sent to the lab for testing. Another one is done after 15 weeks of pregnancy. In this, samples are taken from fluid around the baby, sent to the lab for testing. Generally, it is a safe procedure in expert hands. But in this, there is risk of miscarriage, which can happen in 1 in 200 procedures, some risk of infection, and you can have some discomfort. Any questions so far? Okay, so if you get the time in the exam, only then you can talk about the pregnancy care. And once you will get pregnant, your pregnancy care will be in consultant-led unit under the care of our consultant. And there will be specialist baby doctor, specialist nurse, and the GP will be also in the loop. During pregnancy, we will offer all the routine tests, the Down syndrome screening test and scans to confirm your dates, detailed scan of your baby to see how the baby's organs are developing, growth scans if needed. We will offer vaginal delivery, cesarean section only if indicated. After delivery, baby will be seen by the baby doctors and the blood test will be done to check for the cystic fibrosis gene. Any questions? And I would also like to tell you that you should take folic acid at least 1 month before planning next pregnancy till 3 months of pregnancy. Why? Because it will reduce the problem in the baby's back and brain. Continue the birth control method. I will give the contact numbers and arrange next appointment with consultant and the genetic counselors. Okay, thank you. And I will give if you have already told about the pill in the beginning, no need to repeat it. And when you're talking about 1 minute, any station, like initially we say we will be giving you the patient information leaflet about your condition. Fine. He or she knows about the condition. She has come to know about the test. So if you're discussing about the test also, you can say then and there that I will give the patient information leaflet about these tests. Okay. Clear? Okay. So NIPD and NIPT, I hope it is clear or not clear.
Yes,
All
it
right.
is clear now.
Yes,
Actually, I thought it is NIPT. So that's
yes.
why
You
I
know
didn't know.
what
Yeah.
happened actually when I was preparing for this station. Uh, I thought it is I thought it is NIPT, but then when again I read, then I came to know they have two tests, my dear. And then when I discussed with my friends working in the NHS, they said no, it is two. NIPT, keep it simple, it is for the trisomies. So when we are talking about the Down syndrome screening test, we are offering the NIPT testing. So T for the trisomy. Just remember like that. T is for trisomy and it is not a
Yes.
diagnostic test. So when
Mhm.
NIPT is high risk, we are offering the needle test.
Yes.
It is a screening test, so it needs a follow-up confirmatory test.
Yes. It
NIPD
is used
is
in down screen and
yes,
trisomy.
it is
Yeah.
a diagnostic test. Okay, so I will change this. It is not a screening test. D is the diagnostic test. Mainly, it is done for genetic conditions, few genetic conditions, and it will diagnose the condition. So there is no need of a follow-up invasive test, but may or may not be funded by the NHS. So it is expensive. I will share a patient information leaflet also in the group after the session so that it becomes very clear. And I will change that audio on cystic fibrosis. It's very confusing actually because sometimes everyone follows it. So like I have to give the correct information. Now, what there was a scenario if this same lady is pregnant now and she's having twins. She came to you at about 9 weeks. Okay, she knows she has twins, and she wants to know, like, how to know that her baby will have the condition or not. Then how will you counsel it? Just few sentences you can say.
Yeah, first I'll ask about why does she want to know? Is there any family history or has she been diagnosed with disease so that
Yes.
her
She,
inheritance status I would know.
yeah, she's a both she and her partner are cystic fibrosis carrier. Same lady, and she did
Mhm.
not have any preconception counseling. She's having
And she
twins now.
came at yes, she came
Eight,
at
eight to
uh,
8 to 9 weeks.
eight
She
to nine.
only, she only knows that she has twins and
Yes.
nothing else. So how?
Then I'll ask about the type of twins. Which type of twin is there? Like monochorionic and dichorionic. So that and NIPD, I think that would not be diagnostic in her case. If she is monochorionic, then in that case it can be done. But
Yes,
dichorionic, diamniotic, it would not be done.
very good.
Then yes, then at 9 to 10 weeks, CVS can be done for the
Exactly. This
yes.
is what I wanted
For,
to. Exactly. Whenever such patients will come, they have twins. So in layman language, you will tell her that, of course, we should know the type of, like, whether the child is baby is sharing the same afterbirth or they are having two afterbirths. So you should know it is monochorionic or dichorionic. So if it is sharing the same afterbirth, monochorionic, then NIPD, this diagnostic test is okay. It is just like the singleton pregnancy because monochorionics, they are identical twins, right? So they will be having that same genetic makeup, both the babies, because they are sharing the same placenta. But very rightly you said if it is dichorionic. Now, dichorionic and identical, it is okay. But if it is dichorionic and non-identical, then there will be errors. So in dichorionic twins, there can be error. So in that case, we have to do the needle test. Now, needle test is confirmatory. So even in the needle test, the problem is if it is monochorionic, identical, it's okay. Needle test will be confirmatory. But if they both are sharing two placenta, so of course we are going to take the sample from both the placenta, and the risk will be given for each of the baby. And suppose one is having the condition, other baby is healthy, then we have to talk about the selective termination of pregnancy. Then again, you will involve the fetal medicine specialist and all. Because one candidate told that it was not the preconception station. The patient was pregnant and she was having the twins. So in that case, you are going to deal the station in that way. All right. Okay. So, yes, who will volunteer?
I will do, ma'am.
Yes, your name, please. Who is talking?
Shanti, ma'am.
Yes. All right. Come, please. Okay. Take your 2 minutes.
Next slide, ma'am.
Mm.
Can I start, ma'am?
Yes, okay, you can start, please.
I'm Dr. Shakti, one of the doctor in the antenatal clinic. Can I check your name and age, please?
Yes, I'm Anna Parker. I'm 28-year-old.
Yeah, I came to see from your case notes that you are trying for a second baby and you have diabetes as well, and you want to um, optimize your health before your second pregnancy. Is that right?
Yes.
So, is there any other concerns you want to discuss in this meeting?
Yes, actually, when I went to my GP, he was saying that maybe my blood sugar is not well controlled and it can affect my pregnancy. And, he was also saying that my weight is on the higher side and that can also have some problem during the pregnancy.
Yes, I will address all your concerns. So before discussion, let me ask a few history from you. Is that okay for you?
Okay, yes.
Can you tell me in your own words about your condition, about your
Yes.
diabetes?
Yeah. Actually, I was diagnosed with diabetes when I was quite young, and uh, like the test was done at the time, and I was like they gave me some medications, but they were not helpful. So, like, I'm also taking insulin for a very long time now.
So how many units are you taking?
I don't know exactly, but my midwife is there, the community midwife. She is coming and like she's helping me in that.
Are you checking your blood sugar regularly?
Yes,
Uh, is your are you storing your insulin correctly in the fridge?
yes.
Are you aware of a low carbohydrate diet as well as are you physically active?
Yes, but I'm not so much physically active. I have to sit because I'm an IT professional, so I have to sit and do my work.
Okay, I see. So, can you tell me more about your first pregnancy?
Yes, actually, it was a spontaneous pregnancy and everything was going on well. But in the last few weeks of pregnancy, my blood sugar was not well controlled, and then I had to undergo cesarean section. And my baby's weight was also quite big. He was big. He was 5 kilograms.
Okay. How was the recovery?
Recovery was fine.
Okay. How was the baby doing now?
Yeah, baby is okay.
Okay. Like, regarding your diabetes treatment, does is the diabetes is there any admission recently to the hospital?
Uh, no, no, not recent admission.
Okay. Are you regularly checking with the diabetologist?
Yes, actually, what happened that 2 weeks ago I had an appointment, but I was traveling, so I missed that appointment.
Okay. Is your kidney test as well as eye test has been done?
Yes, yes, they were done in the initial weeks of pregnancy and they were normal.
Okay. No, after that, recently, have you done any test?
No, no.
Okay, I'll make a note of it. Like, um, uh, apart from insulin, are you taking any other medications?
Aspirin, yes. And
Okay.
recently my blood pressure was high, so like I'm taking captopril also.
Okay. Okay. And then, regarding your periods, is your periods regular?
Yes,
When was the last period?
that was 10 days ago.
Okay. Like, do you follow any contraception?
Yes,
GP has written many.
yes, I'm taking mini pill.
Yeah, fine. Are you up to date with your smears?
Yes, they were
So,
not. Yes, yes.
Okay. Do you have, apart from diabetes, do you have any other medical? And then you said you have a high BP and you're taking captopril. Apart from that, are you taking any medications or any other medications?
No. Like I was asthmatic, so I used to take aspirin before, but now I have stopped. The asthma is well controlled now.
Good. Do you have any allergies?
No,
What about your blood group?
A positive.
Okay. What about your any other, apart from this cesarean section, any other surgeries has been done in the tummy or down below?
No.
Okay. Any family history of significance, like personal history or family history of clots is there?
No.
Any family history of genetic disease or any other thing?
No.
Okay. Regarding your personal history, do you smoke?
Well, I do smoke.
Oh, smoking is, so while you're trying for a baby, we always advise you to quit smoking, because smoking is injurious to your health as well as your baby's health. Okay, I'll put in touch with the NHS Stop Smoking Service. If you wish to quit smoking, you can contact them. Okay.
Okay, yes.
Yeah. Do you drink alcohol?
Occasionally.
Okay. Do any sorry to ask, any IV drug abuse?
No.
Okay. Um, what do you do for a living? You
Uh,
said,
yeah, I'm a IT professional.
yeah. Then what about the support at home? Is your partner the supporter?
Yes, very supportive.
That's nice to hear. And what about your height weight ratio? I saw from the GP letter it is 32. Is that right?
Yes.
Yeah. So, do you want to share any other information? Thank you for sharing all the information. Do you want to add anything?
No. I just want to know about my further care plan.
Yeah. Yes, I'm coming to that, Anna. Anna, I have checked your blood sugar, and it shows the 3 month control of the blood sugar is little bit on a higher side, and it should be 6.5, and in your case it is around 7%. Okay.
Okay.
Women with diabetes, uh, when they conceive, when the blood sugar is under control, then they'll have a straightforward pregnancy. So we advise to control your blood sugar before getting pregnant. Okay.
All right. Yes.
I will put in touch with a dietitian as well as a physiotherapist. A dietitian will give you a customized meal plan. They will give you advice about the uh, diet with low carbohydrate scale. Okay, so that your blood sugar can be controlled. And they will also give the physiotherapist also help you with reduction of your weight. So your height weight ratio is little bit on a higher side, and before embarking a pregnancy, we always advise to reduce the weight. Okay.
All right. Yes.
So if the if you become pregnant with a high blood sugar, then certain issues can happen for the baby as well as for you. Do you want to discuss that?
Yes.
Yes, it's, for the baby, the baby can undergo miscarriage, or the baby the that is the baby can form with an to say um,
Deformities.
defective deformities can form, and there is also a possibility of forming a big baby, whereby the baby can even succumb inside the womb. Okay. For the mother, what happens is there is a chance of developing a condition called preeclampsia, where there will be increased blood pressure as well as the protein excretion can occur in the urine, and this is a dreadful condition called preeclampsia can develop in the mother. Okay. And the mother's blood sugar, if and the as the um, as the woman is pregnant, the insulin requirement also increases as the pregnancy advances, and you may need a higher insulin. So you may need additional visit to the hospital, and your care will be under a group of here. Your care will be under a group of doctors like my consultant, as well as diabetologist, midwife, specialist diabetes nurse, as well as the baby doctor, as well as the dietitian, as well as physiotherapist. Is it okay?
All right. Yes, yes.
So until the blood sugar is well controlled and your weight is reduced, we advise you to follow strict contraceptions. Okay.
Okay, yes.
If you are comfortable with mini pill, okay. Otherwise, I will put in touch with the contraception clinic also, so you can discuss a better contraception for you.
Okay. Time is up. Just I wanted to know, did you talk about captopril?
Stop that, madam. Yeah,
You told me to stop, or
I didn't sell. Yeah, I
yeah,
didn't sell. And
yes,
then 5 milligram folic acid also I didn't tell. Yeah.
yes. Because you went to the antenatal care. Don't go to antenatal care. Never rush.
Yes,
Never think
I
you have.
can.
It's impossible in that 5 minutes.
Yes,
Your
ma'am.
diabetic history is very long, I know. So
Yeah.
she has diabetes. She had BMI 32. So yes, history will be a bit long. And you took, I think, nearly 6 minutes in history taking. And when you had this counseling, it was 6 minutes, few seconds more in the history. So you had 3.5 minutes. So
Yeah.
just touch every point. One, two,
Important
three, four.
things.
Important
Actually,
points.
the
Yes,
also
yes. Exactly. When you're talking about the medications, talk, yes. Okay, insulin dose can be increased in the pregnancy. What about now? I'm not pregnant now.
yeah.
So, diabetic doctor and the diabetologist, diabetic nurse is there. They will discuss about this insulin and control of your blood sugar. Captopril, yes, it has to be stopped as soon as you get pregnant or just before the pregnancy. This will be done by your specialist doctor. Continue the contraception, mini pill, fine. And folic acid, higher dose, 5 milligram. And when you will get pregnant, then we have to add few more medications like aspirin to reduce the risk of condition in which there is high blood pressure and protein. Okay, so because I was asthmatic, I stopped taking aspirin. But then again, I have to start taking aspirin in the pregnancy. Otherwise, it was overall fine. Overall fine, but history taking was very, very long. In the
Yes, ma'am.
exam, it will be a problem if your history will be 6 minutes. It
Yes,
has to
ma'am.
be cut it down, cut it down.
Okay.
Okay, so let's have a look at the answer. So you are in the preconception clinic. I understand that you have been referred by your GP because you're having type 1 diabetes and you're planning for a baby. Am I right? I really appreciate that you have come here to discuss your pregnancy plans. Any preconception clinic, you can say that to any patient. And is there any other concern and expectation from today's meeting? So, in a moment, I'll try to address all your concerns. Before that, is it okay if I ask you a few questions to know more about your condition? We need to examine you, arrange some tests, and then discuss the further management plan. I will also give the written information leaflet about your condition and write back to your GP about our mutually agreed care plan. How does that sound? So, can you tell me more about your diabetes? When was it diagnosed? Are you following up with your diabetes doctor? When was the last checkup? And any recent hospital admission? Does your diabetes doctor know about your plans for becoming pregnant? And what did he say? How about your eyes and kidney checkup? Uh, you asked this point, excellent. And do you feel more thirsty or you go to pee more frequently? Do you have a special driving license? You can ask this or not ask this because these patients, diabetics, since they are at risk of hypoglycemia, so on the driving license, it is mentioned they are diabetic. Likewise, epileptic patients, it is mentioned they have epilepsy. May I know when was the last period? How are your periods otherwise? Are you updated with the cervical screening? And are you on any birth control method? SSI, you can skip. Mainly, they are at risk of the candidiasis, not STI. No need here. Okay, have you ever been pregnant before? Can you tell me more about your previous pregnancy and delivery? So you had cesarean section. May I know why? So the weight of the baby was 5 kilogram. How is your baby doing? How was your recovery? May I know your future pregnancy plans? And are you following GP for any other medical condition? And are you taking any medication other than insulin? So you are taking captopril also. May I know why? Because of the high blood pressure. Any allergy to food, drug, or metal? Any other surgery on your tummy or down below? Any family history of concern? Anyone in the family with diabetes? And may I know what you do for a living? Whom are you living with? Is your partner supportive? Do you smoke cigarettes or drink alcohol? Pardon me to ask any recreational drugs. So yes, you told me about stopping smoking, stopping alcohol. That's fine. How have you been feeling lately? Have you been feeling low down? I can see that your weight height ratio is 32. Are you aware of that? Have you tried to lose your weight? May I know your blood group? Thanks for these informations. Would you like to add anything important? I would like to examine you with your permission and in the presence of chaperone just to assess your general condition. Enough. Okay. Now, coming to the test result, I have confirmed your name, date of birth, and NHS number. Do you have any idea about the result? The test was done to assess the blood sugar control in the last 3 months, which is known as HbA1c. I have some concerns regarding the result. Your blood sugars are not controlled, and like since the blood sugars are not well controlled, so if you will embark on pregnancy, then this can be risky for you and your baby. It is recommended that women should conceive only if the blood test result is less than 6.5, and in your case, it is 7%. Am I clear so far? Any questions? So I would like to tell you that women with well-controlled diabetes have healthy pregnancy, they have healthy babies. Problems arise when blood sugars are not well controlled, and they can be risk to mother and risk to the baby. So is it okay if I discuss with you about the risk and strategies to minimize the risk? Risk is even more if the weight height ratio is high. Baby can have miscarriage, can have some birth defects. There can be problem in the baby's brain and heart and excessive water around the baby. Mother can have high blood pressure and high protein in urine. And if blood sugars are not well controlled, you may need hospital admission. This can increase the risk of clot formation. High blood sugars can also affect the eyes and kidney. And babies can also be big, and you can have problems during delivery. You may not deliver vaginally. There's more risk of intervention like cesarean section. So until here, it is okay. Regarding the baby, you don't have to say it will be too much. Even this one sentence is going to consume your precious seconds. So you can skip this line. But just remember, if she asks about the baby, that after the birth, baby can have low blood sugars, some electrolyte or salt imbalance, and may need special care baby unit admission. So when blood sugars are well controlled, then the risk can be decreased, but still cannot be completely eliminated. So our aim is to achieve the blood sugar control. And that is why until your blood sugars are well controlled, we advise you to use the effective contraception. Will that be all right? So here you have to talk about two things: continue contraception until blood sugars are well controlled, and also until your weight height ratio is optimized. So you have to deal with the two problems here. So regarding your care, it's going to be shared care involving the group of specialists, my consultant, diabetes specialist, diabetic educator, dietitian, and the specialist nurse as well. So we will advise you to have healthy balanced diet, and for that this will help you to reduce your weight. So for that, we will refer you to the dietitian. To control your blood sugars, we will advise to continue to follow up with the diabetes doctor and diabetic educator, and you will be advised to check the blood sugars regularly with the glucometer. So may I know, do you have the glucometer machine? Are you checking the glucose regularly? Very nicely, you asked these questions in the very beginning. Well done. Suppose you forget to ask those questions, you can ask them anytime, even when you are explaining the condition to the patient or in the management plan. And you have to do it at frequent intervals. Our aim will be to keep the blood glucose between 5 to 7 millimole. If any time the blood sugar falls, we will advise you to take the glucose drinks and also you will keep the dextrose tablets. If the blood sugar becomes high, then we will advise you to check for a substance called ketones in the urine, and for that we will give you the ketone testing strips. Any questions? I've written all this because you're in the preconception counseling. The blood sugar is not well controlled. So you have to talk about each and everything. And then we will repeat your blood test to check the blood sugar control again. So we will be repeating it every month. This is what the NICE guideline says. In the preconception counseling, we are going to repeat HbA1c every month until it is well controlled. Only when it is in the normal range, you can embark on pregnancy after getting green signal from your diabetes specialist. Also, we will offer tests to check the protective proteins against the rubella infection. If these proteins are not present, then we have to offer vaccination. After vaccination, avoid pregnancy for 1 month. And also we have to offer you the eye and kidney checkups if it was done very long back. Okay. Now regarding the medications, talk about folic acid 5 milligram. Then we have to review the medication captopril, and it is stopped ideally like it can be stopped before pregnancy or as soon as you get pregnant by your specialist doctor. From 12 weeks of the pregnancy, we will offer the medication baby aspirin. This will help to reduce the risk of high blood pressure and urine inprotein. And also vitamin D during the pregnancy and breastfeeding. And all the medications, these medications are safe during pregnancy. Aspirin is also safe. Any questions so far? Okay, so would you like me to discuss further care during the pregnancy, delivery, and after delivery? There won't be any time in the exam. All right, so we will discuss that in our next meeting. As of now, what I will do, I will discuss your condition with my consultant, arrange appointment with the diabetes doctor until your diabetes is well controlled, and also try to optimize your weight. Okay, give the contact numbers. Fine. Diabetes stations are very lengthy, very big stations. And preconception, you have to talk a lot of things. Each and every point in the preconception is important. Okay, fine. Next, who would like to come?
Anita, I will do.
Yes, come please. Okay. You have done structured discussion before, isn't it? I remember.
Yes. Yeah, ma'am.
Okay, okay. I'll change this. This structured discussion is for the person who have not done any structured discussion.
Okay, ma'am.
Okay. Okay, take this one.
Next slide, ma'am. Yes, ma'am. I'm ready.
Right?
My first slide. Yeah.
1 minute. Mhm.
Hello, I'm Dr. Anita, one of the doctor in the preconception clinic. Am I talking to Susan Thomas, 30 years old?
Yes.
So how can I call you Susan?
Yes.
So Susan, I understand you have been referred by the GP as you're planning your pregnancy, and also you have a condition, sickle cell disease, right?
Yes.
Hello.
Yes.
Hello.
Yes. Yes. Yes.
Hello.
Yes, Anita, I can hear you. Hello.
Am I audible?
Yes.
Okay.
Hello. Yeah. Okay,
Yeah.
start again, please. No problem. Start again.
Okay.
Okay.
Hello, I'm Dr. Anita, one of the doctor in the preconception clinic. Am I talking to Susan Thomas, 30 years old?
Yes.
How can I call you?
Call me Susan.
Okay, Susan, I understand you have been referred by the GP as you're planning for pregnancy, and also you have a condition called sickle cell disease, right?
Yes, actually, when I went to my GP and I told him about my plans to get pregnant, he was saying that because of my condition, there can be some problem, and now that is very worrisome for me, and he referred me to you.
Okay. So, Sushan, I appreciate you are here as it's very important to be in the best of health before you embark on the pregnancy. So, Sushan, any other concern apart from this?
No.
Okay, so what I'll be doing is I'll be asking you a few questions if you allow, and also then we can discuss about the further plans. Is it okay for you?
Yes, that's okay.
I'll also provide you with the patient information leaflet at the end, and also we'll get you connected back to the GP. Okay.
All right. Yes.
Okay. So, Sushan, just to know, can you tell me more about your condition? When was it diagnosed?
Yes, it was diagnosed when I was quite young, and
Mhm.
like I used to have some repeated infection. I had some eye and kidney problem also at that time, and
Mhm.
then so many tests were done, and then I came to
Mm,
know that I'm having this condition.
I see. So, when was your last visit with your specialist?
Well, that was 1 month ago.
Okay. And what about any hospital admissions recently?
Well, that was 6 months ago. Yes.
Okay. Any blood transfusions in the past or recently?
No, no.
Okay. And what about currently do you have any chest pain or cough?
No, but I have some cough, and I'm taking antibiotic for that.
Okay. And any joint pain?
No.
Okay. Any difficulty with breathing?
Mm, as of now, no.
Okay. And as you told me, you had some problem with your eyes and kidney. So, was the checkup done again, repeated again for the eyes
No,
and
no,
kidney?
no. That was done long back.
Okay. How about your checkup for the heart?
Well, that was also done, I think, 6 months ago when I was hospitalized.
Okay. What about your support at home?
Yes, I have my partner, and he's very supportive.
Okay. And any previous pregnancies you had?
No, no. I don't have any children.
Okay. And how about your periods? When was it last?
That was about 1 week ago.
Okay. Any other medical conditions, like especially the raised blood pressures or sugars?
Yes, I my blood pressure is. I'm having hypertension recently. Yeah.
Okay. And it seems I can see from the GP letter you're taking medications for that, right?
Yes.
Okay. And are you taking folic acid, 5 milligram?
No, I'm taking the 1 milligram dose.
Okay. Okay. Fine. Any allergies you had?
No,
Any surgeries in the past?
no.
How about any significant history in your family and similar condition running in your family?
Yes, my paternal uncle, he is also having the same condition.
Okay. And how is he doing?
He's okay. Even he's on a lot of medications and having regular checkups with his specialist doctor.
Mm-hmm. And what about do you smoke?
No, no. I stopped smoking completely now.
And I really appreciate that. How about alcohol?
Yeah, I take it occasionally.
Okay, we also need to consider about it because we actually don't know the safe limit of alcohol, and I can refer you to the alcohol stop services. Okay,
Right.
okay. Any recreational drug?
No, no.
And Susan, as you told me, has your partner been tested for the sickle cell disease?
No, I don't think so.
Okay, so what we will do is we'll get connected with the genetic counselors for the same because these conditions can be inherited by your baby also. Okay,
Mhm. Yes.
okay. And how about your height weight ratio?
I think it is normal, 25.
Okay. So thank you so much for the information, Susan. Susan, what I will do is I'll just examine you. I'll check for your BP and also examine you, and we'll also send a few investigations to see how your kidney and your lungs, your livers are functioning. Okay.
Yes.
And also we'll check on. I'll also refer you to the heart specialist doctor to check on the condition of your heart, and also he may do a special scan also for that.
Yes. Okay.
Okay. And are you immune? Have you been vaccinated for rubella?
Mm, I don't remember.
Okay, we'll check on for the proteins for that too. And like Susan, as you know this condition, do you have any idea about it?
Yes, I know that there is some problem in my red blood cells, and it can affect the hemoglobin level and everything.
Yeah, that's very true, Susan. Susan, actually, this is a condition which is going, which affects our red blood cells and also the blood that is the hemoglobin, which is the blood strength. Okay, so what happens in such condition? The shape of the cells, which are round in general, become sickle shaped, and because of which they become very fragile and they break. Okay.
Mhm. Okay.
And also sometimes they occlude the blood vessels, and that may lead to some pain in the chest or pain in the joints. Am I clear to you?
Yes, yes. Okay.
Okay. So Susan, a further management, what we will be doing is like, we'll get connected you to the team of specialists, like the genetic doctors, also my consultant, and your specialist doctor, and also specialist nurse and the pain management team. And we will, before you embark on the pregnancy, we'll try to put you in the optimum of your health. I can see, ma'am, next page.
Yes. Mm-hmm.
So I can see you are on losartan. So before you embark on the pregnancy, anytime before that or at the time you are pregnant, we'll change this medicine to a more safer drug after getting opinion from your specialist. Okay.
Yes.
Okay, and it is advisable for you to continue with the with the amoxicillin antibiotics, and also this hydroxyurea should be stopped 3 months prior to the conception, before you take the pregnancy.
All right.
Okay. And also we'll check on the vaccinations for you, like regarding the vaccination for influenza, pneumococcal, and also the Hep B. Okay.
Yes.
Okay. Until then, and if we'll also advise you certain general measures, like you try to avoid any kind of stress, cold or cold situation, stressful situation, and take adequate rest and keep yourself well hydrated. And also, we'll assess on for your mm, risk assessment for the clot. And also, like it is always advisable to continue with the contraception till you are at the best of your health. Am I clear to you so far?
All right. Yes.
Okay. So, Susan, for the partner testing, what we'll be doing is we can refer you to the be a partner to the genetic testing, and once your partner status is known, then we can plan on your pregnancy. Do you want me to discuss about your pregnancy plans too?
No, no. I want to know if my partner is having the condition, can my baby also have the same condition?
Yeah, generally this condition happens when the baby inherits the gene from both the parents. Okay, so if your partner also has the condition, then we'll be referring you to we'll be referring you to the geneticist, where once you are pregnant, your baby will be tested for the whether the baby is carrying the gene in the form of like what we call the there'll be some testing called the needle test. Okay.
Okay, I see. Right.
Okay. Do you want me to discuss about it?
No, no, not now.
Okay. So right now, I'll advise you to continue with the folic acid and also continue with the contraception, and avoid any kind of stress. And I'll get you connected with the your specialist and also the genetic counselor to get a clear idea about your partner status also. Okay.
All right. Yes.
Okay.
Thank you.
Okay. Thank you.
Just finished on time. Very good. Very well done. Few points because I'm sitting here to add on the missing points, isn't it?
Yes,
Okay.
ma'am.
Good. Good. Very good. So information gathering, I will go back. Complete. Very nice information gathering. Just few points you can ask. How is the environment at your home? I mean, are you staying in the warm environment? Because UK people, of course, it's a very cold place. So sickle cell disease, we know condition can exacerbate if the environment is cold. Communication with patient was good. Communication with colleagues, you involved everyone. And eye checkup, heart checkup, kidney checkup will be by the eye doctor, kidney doctor, heart doctor, and all. Applied clinical knowledge, patient safety. One point in the patient safety and applied clinical knowledge. In the end, you did tell me that avoid stress. You can add few points: avoid cold environment and keep yourself well hydrated. Okay, so these are the general measures. So specific measure which you told what I have to do, about all the medications which you said, and some general measures in these patients. Like in epileptic patients, we are talking about the anti-epileptic drugs. That is the specific measure. Some general measures: avoid stress, take good sleep, isn't it? Lack of sleep can also cause the fits. Same thing will apply here. Partner testing, I was waiting for you to talk about the genetic counselors, which you did say in the end. Very well done. Good. Folic acid 5 milligram you gave me. You stopped captopril and losartan and hydroxyurea. So overall, it will be a pass station, my dear. Good. So you are in the preconception clinic. All right. Hello, I'm Dr. Anita, one of the doctors in the preconception clinic today. May I confirm your name and age, please? How may I address you? Thank you, Susan. I have a letter from your GP, and I understand that you're planning for pregnancy, and you're also having a condition called sickle cell disease. Am I right? I appreciate that you have come here before planning your pregnancy. And is there any other concern and expectations from today's meeting? So in a moment, I'll try to address all your concerns. And before that, is it okay if I ask you a few questions to know more about your condition? I may need to examine you, arrange some tests for you, and then discuss the further care plan. Will that be all right? I will also give the rich information leaflet about your condition and write back to GP about our mutually agreed care plan. Is that okay? During our discussion, please feel free to ask any question. Can you tell me more about your condition, about your sickle cell disease? When was it diagnosed? Do you have any symptoms like chest pain, any difficulty in breathing, any joint pain or leg pain? And are you following up with a blood specialist? Any recent hospitalization? How about your eyes, heart, and kidney checkup? Is the condition affecting your quality of life and how are you coping? Do you live in a warm condition? Do you have enough support at home? May I know, have you ever been pregnant before? When was the last periods and how are your periods? Are you updated with the cervical screening? I can see you are taking the birth control pill, mini pill, am I right? And are you taking it regularly? Any history of sexually shared infection in the past? In fact, you can skip STIs if she's not a high risk case for STI. They mainly have these respiratory infections, not STIs. Okay. So, are you following GP for any medical condition like diabetes and high blood pressure? Okay. So, from the GP letter, I can see you are taking losartan for the high blood pressure, and you're on other medications like hydroxyurea and antibiotic amoxicillin. So, are you taking them regularly? Okay. Yes. Any other medication? Are you taking the folic acid high dose? Not yet, because we know folic acid outside pregnancy, it is always the low dose of the folic acid, a normal dose. All right. So if you will, if you're thinking of like if you're planning pregnancy, then we have to offer you the high dose 5 milligram because it will prevent the problem in the baby's back and brain. Okay. Do you have any allergy to food, drug, or metal? Are you updated with all your vaccines? And any history of blood transfusion? Any surgery on the tummy or down below? Any surgery on your hip, like hip joint replacement? Any family history of similar condition? And history of blood clots? Any family history or personal history of blood clots? May I know, do you smoke cigarettes or drink alcohol? Pardon me to ask, any recreational drugs. So if she's a smoker or alcohol, so yes, actually there is smoking and alcohol. They don't have any health benefit, and we advise to stop them, uh, and more so during the pregnancy because it can affect your health as well as your baby's health. May I know what you do for a living? Whom do you live with? Is your partner supportive? Is he fit and well? Has he been tested for the same condition? If no, so we will arrange the screening for the same condition for your partner as well and offer referral to the genetic counselors. Okay, because it is an inherited condition. It can be transmitted from you and your partner to the baby, so it is important to offer the testing for your partner as well. Am I clear so far? Okay, few more questions. Have you been feeling low or down lately? I can see your weight height ratio is 25. May I know your blood group? Thanks for these informations. Would you like to add anything important? So I would like to examine you with your permission and in the presence of chaperone to assess your general condition, and I can see your observations are normal. All right. So regarding your further care, we have to arrange more tests for you, like blood tests to check your blood level and urine for infection and protein and see how your liver and kidney are working. And also we have to check whether you are having protective proteins against the rubella virus or not. So if not, then we have to offer vaccination and we will advise you to avoid pregnancy for 1 month. Before embarking on pregnancy, also it is very important to check your heart, which will be done by the heart specialist, and the eye checkup will be done by the eye specialist. Okay, any questions so far? Now coming to your condition, do you have an idea about the condition? Okay, if she knows everything, just 1 or 2 lines. Yes, you're right. The condition affects the red blood cells and the hemoglobin, which it contains. Enough. If it is very unusual that she will not be knowing about her condition. If she wants to know more, then you can add on few more lines that red blood cells become sickle shaped instead of being round. They become more fragile, break down easily, and this causes increased risk of anemia where the blood level becomes less and can also cause severe chest pain and bone pain. Okay, now coming to your further management plan, many women with controlled condition have a healthy pregnancy and healthy baby. Problems arise if the condition is not well controlled. There can be some risk to the baby and the mother. So talk about some risk to the baby and the mother also in the preconception counseling. What can happen? Baby can have miscarriage and baby can be small and mom can have some painful crisis in which there is chest pain or bone pain. You can have a condition in which there is high blood pressure and protein in urine. You may go into labor early, or baby can be born prematurely. You can have more water infection and risk of clots in the legs and lungs. So to reduce the risk, we will be also offering you the folic acid, 5 high dose, 5 milligram, and aspirin tablet will be offered during your pregnancy from 12 weeks. I can see you are on many medications, so the medication hydroxyurea has to be stopped at least 3 months before pregnancy because it can cause some structural problems in the baby. Other medication, losartan, it will be changed to safe alternative by the specialist doctor before you embark on pregnancy. As of now, continue contraception until your condition is well controlled. Continue the antibiotics. We will also review the vaccination against the hepatitis B virus, influenza, and pneumonia. And if you have any painful crisis, you will take simple painkillers like paracetamol. Avoid medications like brufen. We will assess your risk factors for clots. Keep yourself well hydrated and as much mobile as possible. Also, avoid some precipitating factors which can cause painful crisis like dehydration. Avoid cold, stress, and strenuous exercise. If you feel tired or you have mild pain, you should take rest. So when you have to talk about the specific measures and the general measures. So it is always a good idea that you can start with the medications which are already given in the GP note. Stop hydroxyurea, stop losartan, continue the contraception, then discuss what we are going to do in the preconception, then talk about the medications which she will need during the pregnancy and general measures. Please don't forget it. Very important patient safety and applied clinical knowledge part. All right, so would you like me to discuss about your care plan in pregnancy? There is no time. Okay, she will ask that, doctor, can this condition affect my baby as well if my partner is having the condition? Yes, the baby can also have the condition. So what we can do that, like we can offer you 2 types of test. One test we can offer even before the pregnancy, which for that we can refer you to the fertility specialist, and they will offer you the pre-implantation genetic testing. And same thing you will explain to her in that your eggs will be collected, mixed with your partner's semen, and there will be a formation of a test tube baby, and the two healthiest embryos, that is baby, will be taken and implanted into your womb. That is before the pregnancy. And during the pregnancy, we can offer you the needle test to see whether your baby is having this condition or not. So would you like me to tell more about the needle test? No. All right. Then you will, if she wants to know the needle test, then you are going to explain what is the needle test. This will be done by the specialist baby doctors under the scan guidance in specialized centers. We can offer it in early pregnancies, in which sample is taken from the afterbirth, or we can offer after 15 weeks of pregnancy, in which sample is taken from the water around the baby and sent to the lab for testing. Generally safe procedure in expert hands, but risk of miscarriages 1 in 200. And some risk of infection is there, and all the precaution will be taken to avoid this complication. Okay. If you have time in the exam, or if the patient comes in early pregnancy, then you can talk about your antenatal care and the labor and delivery. That she will deliver in hospital in consultant-led unit. You would be offered all pain relief options except injection pethidine, vaginal delivery between 38 to 40 weeks. Postpartum care, for me, I always used to follow the mnemonic ABCDF, that after your delivery, we will assess your condition, keep you under observation. Baby will be seen by the baby doctors, provide support for the breastfeeding, and C, assess risk factors for the clots, may offer you blood thinning agents. And another C is for the contraception to avoid any unplanned pregnancy, discharge when you are stable, and also review the drugs if she's on the medications. E and F was like the exit and follow-up plan. So you will continue your follow-up with the blood specialist. All right, so you can say that I will be giving you the support group numbers, contact number for clinical access, arrange appointment with the heart and eye doctor, and continue your birth control pill. Now, there was a station in the exam where patient was on injection DIMPA, and she asked, so after stopping this injection, will I conceive without any delay? So there can be some delay, because on stopping this injection, the release of egg from the ovary is delayed, and like it can even take 1 year for some women to conceive. All right, so sickle cell disease can come as the preconception clinic, or the patient can come in the early pregnancy. Okay. Next, who will come forward? Who is remaining?
Okay, I am Dr. Bushra.
Okay, Bushra, yes. Fine. Maria is also there. And who else? Dr. Vidya Lakshmi or Vijaya Lakshmi? I don't know if she has joined today. No problem. Okay. Something. Okay, take this one. Take your 2 minutes.
Next slide.
Yes.
The first slide, please.
Yeah.
Okay, I can start now.
All right, start please.
Hello, I am Dr. Bushra, one of the doctor in the antenatal clinic today. May I confirm your name and age, please?
I'm Sally Jones, 32-year-old.
How can I address you?
Call me Sally.
Okay, Sally, I can understand from your clinical notes you came here to discuss your ultrasound report. Am I right?
Yes.
Okay, Sally, definitely I will address all your concern and we will discuss the ultrasound report. Then we will make the management plan that will be mutually agreed and safe for you. Can I ask you question to better understand your condition? How does it sound?
Yes, that's okay.
Okay, may I know how the pregnancy is going on so far?
Yes, this is my first pregnancy, and I'm very happy that I have conceived, and everything has been going like well and good so far. No problem at all.
Okay, and this is your planned pregnancy
Yes,
and you conceive spontaneously?
yes.
Okay, and what about your investigation and scan result and Down syndrome screening with your midwife?
Yeah, they were normal. No problem at all.
Okay, and do you have any pain below your tummy?
No, no.
Any vaginal bleeding?
Well, I had some bleeding in the initial weeks of my pregnancy for about 2, 3 days, but it settled on its own. I did not have to take any treatment.
Okay, and now it is settled, huh?
Yes.
Yeah. Okay.
Mhm.
Okay. Any waterworks and bowel problem?
No, no,
Okay. And Sally, do you have any recurrent chest infection?
no, no,
Okay. And in the earlier part of pregnancy, do you have fever with flu and rash?
no.
Okay. And when was your last menstrual period?
5 months ago.
Okay. And your periods are regular?
Yes.
And your are you updated with your pap smear?
Yes, they are normal.
Okay. And do you have any condition for which you are visiting your GP, like high blood sugar, high blood pressure, asthma, epilepsy?
No, no,
Okay. Any family history of concern in your family? Any special baby or any diseases running in the family?
no, no.
Okay. And your partner is fit and well?
Yes,
Okay. And do you have any surgeries below your tummy and down below?
no,
And are you allergic to any medication?
no,
And currently, are you using any medication?
no.
Okay, and are you aware of your weight to height ratio?
Yeah, 24.
Okay, and what is your blood group?
A positive.
And do you have any reservation of blood?
No, no,
Okay, and some personal question, Sally, do you smoke?
no. I quit smoking
Okay, I appreciate it, Sally. And drink alcohol
occasionally.
and using any drug for recreation.
No, no.
What do you do for a living?
I'm an engineer
Okay, and with whom do you live?
with my partner.
And your partner is sportive?
Yes.
Okay. And Sally, do you feel any time low mood and depressed last month?
No, no.
Okay. Do you want to add anything?
No. I want to know about the report. I mean, the scan report which was done.
Okay, definitely I will discuss with your this report with you. Okay, Sally, thanks for giving me useful information. Now I want to examine you in the presence of chaperone, your general condition and the examination of her tummy. It's okay?
Yeah, that's okay.
Okay, thanks for cooperation, Sally. And Sally, I can see you are alone. Do you want anyone accompanying you before discussing the report?
No, you can carry on. I hope everything is okay.
Yes, Sally, but I have some concern in your report. If you want to be with you,
No, it's okay. Carry on, please.
Okay, Sally. Your ultrasound report is with me, and I confirm your name and HS number, and this report is belong to you. In this report, you are having the baby, and this is male, and baby is fine, but and 20-week age, and the position of the afterbirth and water around the baby is normal. But there is some concern regarding the baby bowel. The bowel is brighter than the usual. And in medical term, we call is echogenic bowel. Have you heard about that?
No, no. So is my baby having abnormality in the bowel?
Uh, Not abnormality, but the bowel is brighter than normal structures.
All
Okay,
right.
and there most of the time the baby is normal and having no abnormality at all. Okay, and but in some cases it can be happen, maybe you have, as you inform me, you have the bleeding in the early part, 2 to 3 days before you have early part of the pregnancy bleeding, and if the mother has a bleeding and bleeding in the womb also present, and baby can swallow this blood, so in this case the bowel can appear brighter than normal. Am I clear so far?
Yes.
And it is a harmless condition. Okay.
Okay.
Okay, and sometime there is a infection. Is mother has an infection. This is called cytomegalovirus, and one of 10 babies might be have the infection at the time of the birth. Then in this case, this bowel can be brighter than normal. Okay,
Mhm.
and another condition that can be happen. It is. Called cystic fibrosis, and this is the condition in which the mucus that is secreted in our lungs and digestive tract become thicker, so it is causing recurrent infection. Am I clear so far? And 3 out of 100 babies with cystic fibrosis might have the bowel brighter than normal. Okay, but
Yes.
for that we can test you and for your partner to see if the you and your partner are the carrier of this condition disease, then the baby might have this cystic fibrosis. Am I clear so far?
Yes. Okay.
And last, there sometime if after birth is not functioning normal and blood supply to the baby is not going, then it is called means small for gestational age babies. And these kind of the babies also have the bowel brighter than normal. I'm clear so far.
Yes. All right.
So I would. Do you want how we will manage you further?
Yes. Okay.
Okay, Sally, from now, I would like to connect you. I mean, we will manage as the team of the doctor over consultant and the specialist baby doctor belong to the fetal medicine unit, and also genetic counselor and specialized nurse, and also involve your GP in your care plan. Okay, and first of all, we will refer you to the specialized doctor. They will do the special ultrasound to see the baby and reconfirm the finding. Okay,
Mm.
and also we will do your blood test to see the infection for cytomegalovirus, and we will screen you and your partner for the cystic fibrosis. Am I clear so far?
All right. Yes.
Okay, and if your test for cytomegalovirus will be positive and screening of you and your partner is indicating there is a chance of a cytomegalovirus gene, then we will refer you for the special test. This is called needle test. For by this test, we can see the baby condition and genetic makeup, and is either baby is having also infection or not. Okay.
Mhm.
Do you want me to explain about needle test?
No, no, but baby's genetic makeup was already tested. They are saying baby's not having Down syndrome or anything.
Yes, I can understand. But first of all, we will check you, screen you and your partner for the cystic fibrosis.
Yes.
Down syndrome, you already done. That is one normal. But this test will be, we will do for know the cystic fibrosis, and also this Down syndrome screening is a screening test. You are at a low risk for Down syndrome, but to confirm, we can confirm this. This is a definitive test, needle test. I mean, you baby has a confirmed Down syndrome or not.
Okay, and can this condition affect my baby's growth?
Yes, if all these investigation will be normal and your baby most of the time baby is will be fine, but then we will arrange your further appointment in the consultant led unit, and from 26 to 28 week of the pregnancy, we will follow you. We will follow the baby with the growth scan to see either the afterbirth is supplying the baby blood is
Close.
adequate or no.
Time is up.
Okay.
Close. This is what I wanted to hear. Growth scans is important because there
Yes.
is risk of FGR. Okay, close the
Yes.
section.
Okay, and I will connect you, I will fix your appointment with my consultant, and I will provide you patient information leaflet. You can read it. Okay,
Thank you. Yeah.
and do we have any question?
No, 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 no. Thank you. Thank you. Yeah, everything was okay. You went little more deep in cystic fibrosis. Okay, so keep it simple. We are going to test you for this infection, CMV infection, and this gene cystic fibrosis condition in which there is repeated infection. But we know that most likely baby will be normal. So just say that only touch the points. And what can happen here that baby can be smaller in growth, isn't it? So
Yeah.
that is the thing on which we will be concentrating more as obstetricians. And when a baby is diagnosed with echogenic bowel during the anomaly scan, at that same time, we will ask the patients that any other special scan was done to check the blood flow in the baby's afterbirth. Uterine artery Doppler has to be done at the same time when echogenic bowel is detected, isn't it? This is in the new FGR guideline. Very important point in that guideline. And second thing that also we will be arranging for the growth scans and again specialized scans to assess the blood flow in the baby because baby can be small. And if the baby's growth is normal, you can have delivery at term. And if the baby's growth is not normal or baby is small, then maybe we may have to deliver your baby a little early. Few sentences just to show that you know what you're talking about. I'll just come here. All right, so this is the thing. Very important now for from the new GTG. Okay, arrange for special scan to assess blood flow in the babies after birth if it is not done, because the report is only ultrasound scan, anomaly scan. We don't know anything about the uterine artery Doppler. Okay, so this has also to be done. And echogenic bowel babies, we always follow up with the scans. To like one will be the Doppler scan, Doppler and growth scans. Okay, from 32 weeks. If you can't remember 32 weeks, 28 weeks, 26 weeks, it becomes very confusing at times. So you can just say growth scans in the later months of pregnancy. It will be growth scans done at frequent intervals in later months of pregnancy to assess the growth of the baby. Okay, I hope now no one will forget. You will also not forget. Okay, Bushra?
Okay, thank you.
Right. Okay, let's go back and discuss the answer. Okay, so you are in the which clinic? Antenatal clinic. Sally. Okay, Sally, I understand that you are here to discuss your baby's scan report. Am I right? Or you can say like little bit more that Sally, I can see that this is your first pregnancy and you are here to discuss about your scan result. Am I right? Is there any other concern and expectations from today's meeting? I appreciate your concerns and in a moment I'll try to address all of them. Before that, is it okay if I ask you a few questions to know more about your pregnancy, then discuss the scan report and further care plan? So can you tell me more about your pregnancy? How has been your pregnancy so far? Oh, doctor, I'm so happy. This is my first pregnancy. Many congratulations. I can see how happy you are. So, okay, if you are confused, there is echogenic bowel. Now, should I congratulate this patient or not? So just you can say, yes, I can see how happy you are. Okay. Any problems during pregnancy? Any bleeding, fever, or flu-like symptoms? Was it planned and spontaneous pregnancy? Okay, and how about your previous scans and tests? How about the Down syndrome screening test? All are normal. That's good to know. And I can see from the notes that this is your first pregnancy. Am I right? May I know your future pregnancy plans? Okay, are you following GP for any medical condition? Do you have condition in which there is repeated chest infection, which we call a cystic fibrosis in medical terms? Any problem with digestion? Are you on any medication? Did you take folic acid? Any sort of allergy? Any surgery on your tummy or down below? Any family history of concern? Anyone in family with repeated chest infection, or anyone in the family with cystic fibrosis condition? Okay, if she says, what is cystic fibrosis, doctor? What are you talking about? Well, it is a condition in which there is repeated chest infection and there can be some digestion problem. And it is an inherited condition. Okay. And may I know what you do for a living? Whom do you live with? Is your partner supportive? Is he fit and well? Is he having any medical condition? Do you smoke cigarettes or drink alcohol? Pardon me to ask, any recreational drugs? She stopped smoking. I appreciate that. She is taking alcohol occasionally. No alcohol in pregnancy, my dear. You have to tell her that there is no safe limit of alcohol in pregnancy. It can have adverse effect on you and your baby. So, is it okay if we put you in touch with our stop alcohol services? All right. Have you been feeling low down lately? May I know your weight height ratio? If it is written normal, okay, I can say it is 24. May I know your blood group? Thanks for these informations. Would you like to add anything important? All right, now coming to the scan report, do you have any idea about the scan result? I have confirmed your name, date of birth, and NHS number. Tell the good thing first that you're having a single male baby, heartbeat is present, water around the baby, and after birth is normal. You're 20 weeks in your pregnancy. I have some concerns regarding the baby's bowel. Bowel appears brighter than normal, and we call this condition as echogenic bowel in medical terms. Have you heard about it? Actually, in most cases, the cause is not known. It may appear as an isolated finding only, and in many cases, the baby is normal. It can occur in less than 1 in 100 pregnancies. So, what could be the causes? It can occur if the baby has swallowed some blood, like you had bleeding in your early pregnancy. If the baby is having genetic problem, but I can see your Down syndrome screening test was normal. If there is like viral infection to you or your baby, and if there is any medical condition in which there is repeated chest infection. If there is bowel obstruction, which can happen because of increased mucus production, which is a sticky substance. If the baby's growth is not normal, and if the baby is small. Any questions so far? Okay. So regarding your further care, it will be shared care involving my consultant, the specialist baby doctors, genetic counselors, specialist nurse, and your GP. So we will offer appointment with specialist baby doctors, and they will offer specialized scans on your baby to reconfirm the finding and to see how the baby's organs are developing. We will offer tests to you and your partner to check for the cystic fibrosis gene to confirm whether this gene is present or not, and blood test for infections. Needle test can be done to check for any genetic problem and for any infection in the baby. So, do you have idea about the needle test? Would you like me to explain more about the needle test? If she says yes, then okay, you will explain. Needle test is done by the expert baby doctors under the scan guidance. And what happens? You can explain, draw in the exam. If you can draw, scribble something. This is the womb, the baby, and water on the baby. Needle will be inserted through your tummy and in your womb, and small amount of water will be taken from around the baby, sent to the lab for testing to check for any genetic condition and for infection. Generally, it's a safe procedure in expert hands, but there is a risk of miscarriage, which can happen in 1 in 200, and there is some risk of infection. Am I clear so far? So, may I know what are your thoughts about the needle test? If she doesn't want to know anything more, you don't have to say anything. She will say, no, can you tell me how are you going to manage this pregnancy? All right, so if the test results are normal, like you can continue with your pregnancy, and we will offer you all the support and care, offer booking in consultant-led unit, and continue your further pregnancy care. In each visit, we have to check the blood pressure and urine for protein and assess risk factors for clots. Also, I would like to know that any special scan was done at the time of the scan of your baby. So we have to arrange a scan to assess the blood flow in the baby's after birth. And also further special scans will be done to assess the blood flow in the baby's cord, and growth scans at regular intervals in later months of pregnancy to assess the growth of the baby, because sometimes the baby can be small in this condition. And many babies, they don't have any mental or physical problems or any serious problem. And regarding the labor and delivery, just keep it short. We will advise to deliver in hospital in consultant-led unit. Baby will be delivered at term if the growth is normal, or early if the baby is small, provide you one-to-one care. After the birth, baby will be seen by the baby doctors. Okay, any questions? Now, if she starts blaming herself, then of course you're going to say, please don't think like that. It's not because you have done or not done something. Condition can happen without any cause, and many babies are normal. If she's still stressed out, offer appointment with the counselors, give her the support group number. Now, if she wants to know about the needle test results, the doctor, what can happen with the needle test? So the results can be of two types. It can be normal or abnormal. There can be some genetic problem in the baby, and if that happens, then we will discuss with you about your options of continuing or not continuing the pregnancy, and whatever decision you will make, we will help and support you in that. And if tests are normal, then of course you can continue with the pregnancy. Then you can talk about all this. Okay. So the answer template is changed because of the new fetal growth restriction guideline. Okay, my dear. Well
Okay.
done, guys. Yes.
Excuse me, doctor. You write here we will arrange a special scan to assess blood flow in the baby after birth or in the womb. Because this uterine artery Doppler blood flow of the womb.
Yes.
And babies after birth mean this I'm like
Yes, this was actually written in a patient information leaflet. So I took from there. If you will see the FGR patient information leaflet, the SGA patient information leaflet, both are correct. Both are correct because you're trying, as you're saying, to assess the blood flow in the baby's womb because it is the uterine artery Doppler. So, okay, keep it simple in the baby's womb. Fine. So that's okay. And umbilical artery is the umbilical cord. So this will be the in the baby's cord. Okay. So it's okay. You can say that also. Assess the blood flow in the baby's womb. Okay. All right. So who will come next? We have Dr. Maria.
Yes, Dr. Shubham.
All right. So 1 minute. I think you have not done any structured discussion.
Yes, I will do.
Yeah, take this test. Take your time.
Right. Next slide, please.
These are main two slides. Third slide, I have questions, so I will ask the questions.
Right.
Ready?
Yeah, I'm ready for discussion.
All right, start please.
The question, please.
No way. Introduce yourself.
Okay, yeah, I have to start on this. Hello, I'm Maria,
Yes.
and I'm ready.
Okay. So can you summarize the case?
Yes. This is the case of Mrs. Jennifer Brown. She is currently 36 weeks of pregnant, and she had a history of the renal transplant, right? And about her background, this is her first pregnancy, and she's 35 years of age, and she had a history of the renal transplant 3 years back. She's also on immunosuppressant. She's taking azathioprine, cyclosporin, and prednisolone, aspirin, and multivitamins. And about her observations, assessment, her observations are her weight, height, ratio, BMI is also within normal limit, 24.5 kg.
Yes.
About her assessment, her blood test, her hemoglobin is 9.9, that is showing anemia. And her blood group is A positive, and well, her HP is decreased while her ferritin is normal. And about her other blood tests, all are normal. Down syndrome screening is also in low risk. And about her renal function test, kidney function test, creatinine is increased, uric acid also deranged, sodium is also increased, and also potassium is increased. So kidney function test is deranged. So about her recommendation, I will take detailed history of the patient, and I will perform examination and run some investigation, and then we'll make management plan.
Okay, so do you think there is indication for delivery? And do you think she needs cesarean section now?
As she's having history of the renal transplant, and currently she's 36 weeks pregnant, and her renal function tests are deranged. So this is considered as a high-risk pregnancy. So renal transplant itself is not indication for the cesarean section, but her renal function test, as it is deranged, so she needs immediate delivery. We have to expedite her delivery. So we will offer her induction of labor, and if yes, then we will go for, of course, for cesarean section. And before induction of labor, we will assess Bishop score, and accordingly, then we will decide.
Okay.
That's all.
Okay. All right. So discuss and justify your further management plan, keeping in mind patient is 36 weeks pregnant.
Right. About further management, of course, I will take her detailed history. I will perform examination, and then I will run some investigation, and then finally I will make a management plan. So for history, I will ask detail about her condition. Her renal transplant history. I will inquire about it. And I will inquire that why did it happen? It's mentioned here that it is due to the glomerulonephritis. Yes. I will inquire about that. Is it affecting its quality of life or not? Right. And also, I will know about her, symptoms like whether she's having any swelling in the legs or in eyes, and also would like to know about any shortness of the breath, and any easy fatigability, tiredness, right? As she's anemic. And also would like to know about current pregnancy, that whether it was a spontaneous pregnancy or planned pregnancy. And would like to know about also her future pregnancy plans. and also about inquire about her gynae. Would like to know how about about her last menstrual period, and how were her cycles, and also about her yes, was she using any form of the contraception? Would like to confirm whether she was using a safe and effective type of the contraception earlier or not, as she's a case of renal transplant. And also would like to know about her cervical screening. Is she updated for screening or not? And she's an immunosuppressant also. Whether she's going for screening annually or not. And also would like to know about her other medical condition, about blood pressure and sugars, diabetes, hypertension. And also would like to know any other medication she may be taking, and any allergy from any medicine or any substance, and any previous history of surgery of tummy or down below, and also history, family history of, chronic renal disease, or yes, especially for chronic renal disease. Also would like to know about her social, yes, about that, whether is she smoking, is she drinking alcohol, using taking recreational drugs, and also would like to know that what does she do for a living, and whom does she live, if she's living with partner, is he supportive or not. And also would like to know about her mental health. I would like to know about her, mental health history. That has she been feeling down or depressed in the past few weeks? And also mm, about her, yes, blood group, and BMI is already, I guess, mentioned. Yes, a blood group, about her blood group, and any reservation for blood transfusion. About after history, once I will completed it, then I will perform examination with her permission in presence of chaperone, and I will check her. I will do her tummy examination to see how this baby is doing, and what size of the tummy, and then I will do also her down below examination to assess the bishop score. And after that, I will discuss the patient about risk to the baby and risk to the mother. So I will discuss her in detail that there are the risks to the mother, like her condition can be deteriorated more, and also she has a risk of this high preeclampsia, and also as her HP is already decreased, there's more risk of anemia. Regarding this to the baby, we'll discuss about the like there's a risk of preterm deliveries and IUGR babies, and also baby may need an ICU admission. And about after risk, yeah, I will discuss about yes, delivery plan. Is I earlier told you that we will advise about upper induction of the labor after assessing the bishop. If induction failed, then we will go for the cesarean section. Our patient refused for induction, then again we will go for the cesarean section. And also in her care, I will involve the multidisciplinary team, and her care will be, shared care. I will involve my consultant, I will involve nephrologist, I will involve the renal transplant team, and specialist nurse and midwife. Also, yes, I will repeat her kidney function test, and also I will during labor, I will also monitor baby fetal heart rate by continuous electron fetal monitoring, continuous yes device. Also, we will this patient is taking steroid also, so I will also uh, give her stress dose of the hydrocortisone during the labor. Um, and after delivery, postnatal, I will assess her general condition, and I will encourage her for breastfeeding. And baby will be checked by the baby doctor, and she will be assessed for clot, blood clots, and then accordingly I will provide her chemoprophylaxis and also encourage her for early mobilization, and will ask her for veil hydration, and also the medicine whichever she's taking she will continue after follow up with the nephrologist and the kidney transplant team.
Time is up,
And
but just one last question you can answer. What precautions you will take in this case to reduce the risk during cesarean section?
yeah, I want to say. Actually, as this is a high risk pregnancy, so this should be done under supervision of the consultant, in presence of the consultant. And as there is a renal graft, so we need to get done ultrasound before giving the skin incision to locate the graft site. And also we need to give the incision at the skin midline, and at the uterus it would be a transverse incision. And also we need to give yes, she had a previous menisca, so there are the chances we may find the adhesions, and also there's a risk of graft injury 1 to 2%.
Right. And incision on the uterus and abdomen?
Transverse incision and skin incision will be midline.
Okay, thank you. All right, good effort. I know you have passed recently in July, isn't it? Result.
Yeah.
Yes, yes, you texted me that. So for you people, you have the courage to come forward and talk. Good. Very good.
Yeah, Dr. Shabana, I cleared my exam in 3-month preparation, and it was in a first attempt, alhamdulillah, with my very hectic job. So I really need to study again in detail. So I was feeling that whatever happened, that happened good for
Yeah.
me.
Yes, yes, it's okay. It's okay. I know you were very upset you could not book the exam, right? But okay, at least you have the time to practice more. But
Yeah.
yes, all those who could not book, I will always say keep mailing the RCOG. I remember my study partner and she could not book and she got mail 3 weeks before the exam that we have few spaces. Would you like to opt? My God, it was anyway, she was studying. She never left her prepared study. So she opted and she passed the exam.
Wow. Right.
So yes, so like even if you have not got the seat, keep mailing and keep maybe you will get yes. All right. So right now, when we are talking about, the idea, situation, background, assessment, recommendation, situation. Yes, you told that my patient Jennifer Brown, what is the situation now? She is now 36 weeks with renal transplant, which was done 3 weeks ago. And background, 35 years old. She's a primary gravida. Renal transplant was done because of glomerulitis. She's having regular follow-up with a nephrologist and renal transplant team. She's on immunosuppressants, aspirin, and multivitamins. And right now, she has been advised for cesarean section, but she's refusing cesarean. So, situation background on assessment, all her observations are normal. BMI is also normal. Blood tests were done, so she's having hemoglobin is low, breast ferritin is normal, so most likely it is anemia because of maybe recombinant erythropoietin deficiency. And regarding the other test, I can see that viral screen was done, which is normal. Rubella immunity, she's immune to rubella. And Down syndrome is low, but kidney function test is. And also comment on the ultrasound scan. This also comes in your assessment. So ultrasound scan is normal, baby is appropriate for gestation age, and the growth chart is also normal. Baby is at the growth is at 50th centile. Baby is appropriate for gestation age. So summarization is done. And is there any indication for cesarean section now? So justify your answer. So yes, kidney transplant is not an indication for cesarean section, but as of now, she's a high risk case. She's having renal transplant and deranged kidney function test. So there is indication for delivery either by induction of labor or cesarean if induction fails. All right. Now, patient is actually refusing cesarean. So in that case, we have to counsel the patient that if induction of labor fails, then we may have to take her for cesarean section. And still refusing cesarean, then of course I will be involving my consultant and also the counselor. You have to tell that baby has to be delivered in view of deranged kidney function test. Otherwise, there is further risk of deterioration of the kidney function. As of now, we can offer induction of labor after assessing the Bishop score. There was another scenario in which kidney function and everything was normal, and patient was offered cesarean section. So in that case, you are going to, of course, discuss with the consultant that everything is okay. So why has she been offered cesarean section now? And if kidney function test is within the normal range, everything is okay, there is no complication, then we offer delivery between 37 to 40 weeks. So no early delivery if everything is okay. Now you have to discuss and justify your further managed plan. Everything, whatever you talk in the structured discussion, you have to justify. So that was your assessment. So for my recommendation, of course, I have to take detailed history, offer examination, relevant investigations, and then I will be discussing my further management plan and recommendation. So regarding the history, I would like to know details about the renal transplant. In her case, the indication is it was done for glomerulonephritis. How she coping? Any effect on quality of life? Any episode of graft rejection? What uh, are the signs of graft rejection? Can anyone say whatever you remember? What can happen in graft rejection? Graft is in the abdomen. So what can happen in the abdomen? Tummy pain, she can have fever. Yes, Dr. Shanti, I heard your voice.
Deranged kidney function.
Yes. Okay. And what could be the symptoms of graft rejection? Any graft, I mean, in her case?
She will have fever, pain.
Yes, of course. Yes, yes. And deranged kidney function test can happen. Exactly. Okay. And I would like to know about the symptoms like swelling in the legs or around the eyes, any dysuria, any symptom of anemia, because hemoglobin is 9.9. So I would like to know if she is having shortness of breath or palpitations, any confusion or vomiting. Confusion or vomiting can also happen in if there is graft rejection. And would like to know about her current pregnancy, whether it is planned and spontaneous. How about any problems so far? What about her future pregnancy plans? Gynae history, although in general we are not taking gynae history in OPS cases, but in renal transplant, you can add the point that I would also like to know whether she is having her cervical screening annually in her case. And how about the result? Okay, then other history, any other medical condition like diabetes, hypertension, whether she's on other medications, any allergy, and wait, I'll mute all. There is some background noise. Okay. Social history, smoking, drinking alcohol, recreational drugs. What about her occupation, partner and support? And is the partner fit and healthy? Mental health history to assess her mood and depression, blood group, confirm the blood group, any reservations for blood transfusion. Would like to examine with her permission in the presence of chaperone to assess her general condition and to assess how the baby is growing and assess risk factors for venous thromboembolism. So in the examination itself, you can add these points, risk factors for VTE, so that you will not forget. And then after examination, history, examination, investigation. So I would like to know about the proteinuria. This is the investigation which is missing there, isn't it? No proteinuria has been mentioned. So if proteinuria is more than 5 grams, we have to start the thromboprophylaxis. Then discuss the risk during the pregnancy. Risk to the mother includes preeclampsia. There can be further deterioration of the kidney function, risk of anemia in her case. So we can offer recombinant erythropoietin after discussion with the hematologist. Now, risk to baby, there can be FGR, but in her case, baby is normal for gestation age. Still, there is risk of preterm delivery, iatrogenic prematurity, and ICU admission, transmission of kidney disease. What about the delivery plan? So here it is deranged kidney function test. So we can offer induction of labor. If it fails, offer cesarean section. And her further care will involve the MDT, including my consultant nephrologist. This is the word written in the talk. Consultant nephrologist, renal transplant teams, neonatologist, specialist midwife, and the nurse. Would like to go through the antenatal notes to see her delivery plans if it has been mentioned, because in the renal transplant patients, the delivery plan is already mentioned at 28 weeks, like what could be the delivery. So if kidney function test is normal, we offer delivery between 37 to 40 weeks. And for induction of labor, we can use all the inducing agents. She will be provided one-to-one care, continuous electronic fetal monitoring for the baby. If episiotomy is given at the time of induction, then we will offer prophylactic antibiotic to reduce the risk of infection, because otherwise with episiotomy, no antibiotic is given. Only patient is given analgesic. Patient is on prednisolone. So we have to offer the IV hydrocortisone, the stress dose. If you can remember the dose, well and good. It is 50 to 100 milligram IV, 6 to 8 hourly. Particularly if she was on a dose of prednisolone of more than 7.5 milligram per day for more than 2 weeks. Even if you will say IV hydrocortisone, enough. Careful monitoring of the fluid by judicious use of fluid input-output chart, very, very important in these patients. Active management of third stage of labor to reduce the risk of PPH, very important. Ergometrine has to be given carefully. It will not be given if patient is hypertensive, very important point. Postpartum, I always use the mnemonic A, B, C, D, E, F. It really makes the life easy. So postpartum care will include assessment of the patient and close observation. B, provide support for breastfeeding. Another B, baby will be seen by the pediatrician because baby may be at risk of infection and adrenal insufficiency. Coming to C, clots. So assess the risk factors for thrombosis, offer thromboprophylaxis, encourage mobilization, adequate hydration. Another C is for contraception, suitable contraception to avoid unplanned pregnancy in future. So she will not take any estrogen containing contraception. D, review all the drugs which she is taking. E and F is like the exit and follow-up plan. So follow up with the nephrologist and the renal transplant team. We'll give her the patient information leaflet about the condition, support group, and contact number for clinical access. So what are the safe and effective contraception? So as per the talk, and we have this FSRH guideline. So progesterone only contraceptions are the UKMEG 1 for these patients. All right. And yes, no copper IUCD because of risk of heavy menstrual bleeding, and this can precipitate anemia. Now, what precautions will you take during cesarean section? So any surgery, always talk about the WHO safety surgical checklist. Any surgery, hysterectomy, myomectomy, whatever it is, WHO safety surgical checklist. Now, there is increased risk of complication during cesarean, so consultant has to be present, or cesarean section can be done under the supervision of consultant. Renal transplant team has to be there. There is risk of adhesion because of the previous transplant surgery and risk of injury to the graft. It is 1 to 2%. What about the incision? Skin incision is midline. Why? Just justify, because it will give a wider field of view and reduce the risk of injury. Uterine incision will be the transverse one. Ultrasound scan just prior to skin incision to locate the graft. Okay, so just 1, 2, 3, 4, 5 points. All right. Last case. Okay, this is from the talk. You just have to know the teratogenic medications and which medications are considered safe in breastfeeding and safe in the pregnancy. Okay. Hydroxychloroquine is a very important medication in SLE also. So sometimes people get confused. No, it is a very safe medication. We can give hydroxychloroquine. Okay, just have a look at this one and look at this one. One more case. I need a volunteer now.
Dr. Shabana, I want to ask one question.
Yes.
Actually, in structure discussion, when we are going to summarize the case, is it necessary we have to just tell about that this is a situation, this is a background assessment, or we have to just directly, I mean, mention this and no need to just hide it?
Yeah, you can keep that S bar in your mind. So you don't have to say what is the situation. So my patient, Jennifer, she's 36 weeks pregnant now, and she had a renal transplant. And at the moment, she has been advised for cesarean, but she's refusing surgery. She is 35 years old, primary gravida, and all her tests, she's having regular follow with a nephrologist. And then keep in mind what is the next part, assessment. So investigations are normal, except ferritin is, hemoglobin is low, kidney function test is deranged, and ultrasound scan is normal, growth scan is normal. Okay, so you have to say that situation, background assessment. And for the recommendation, I have to tell about the history, examination, investigation, management. This is the exam. So they want that S bar. They have a big guide, not guideline, there is an article on the S bar, because this is how they give the hand of the cases. What is the situation? What is the background, assessment, recommendation?
Right.
All right, Dr. Vidya Lakshmi, have you joined today or not? No, she's not there. Now I want a volunteer.
Can I?
Yes. Whose voice?
Anita.
Yes, yes. Whose name is Ariana Tanveer?
My niece. Actually, I have joined my sister's last time.
Right, right. Okay, this is Anita.
Yeah, ma'am.
Fine. Come, please. Wait, I have to see which case we have left. Yeah. Take this one.
Okay.
Take you 2 minutes.
Sure. Next page, ma'am. First page. I'm done.
Yes.
Can I start, ma'am?
Yes. If you're ready, start, please.
Hello, I'm Dr. Anita, one of the doctor in the ANC clinic today. May you confirm your name and age?
Yes, I'm Rose Parker, 29-year-old.
How may I call you?
Call me Rose.
Yeah, so Rose, I can see you had undergone a scan report and you are here to discuss about it, right?
Yes.
So Rose, I'll definitely discuss about the scan and also address all your concern. Can I ask you a few questions prior to that?
Yes, it's okay.
Okay. So can you tell me more about this pregnancy?
Yes, actually, this is my second pregnancy, and it was a planned one. And everything is okay until now.
Okay. So you're taking your all vitamins and vitamins, right? And folic acid?
Yes, actually, I started folic acid very late because I came to know about my pregnancy very late.
Okay, I see. And how about your Down syndrome screening? Has it been done?
Yes, it was normal.
Okay. And what about any previous apart from the second pregnancy, was it a normal or cesarean?
It was normal.
And the recovery was fine?
Yeah.
Any significant medical history?
No,
Any allergies?
no.
Any conditions running in family, genetic conditions or any other problem?
No, no.
Okay. How about your height weight ratio?
25.
Okay. And how about your support at home?
Yes, I have my partner and he's very supportive.
Okay. I see. Rose, I can see the scan report is with me. I've confirmed, ma'am, next page, please.
Yes.
I've confirmed it with your name and NHS number. And what the scan report says is your baby is a boy, and the fetal heart sound is also okay. Baby is normal in appearance, and the fluid around the baby is also fine. Okay, but I
Yeah.
have a certain concern regarding the baby's feet. Actually, what it says, your baby's is having bilateral talipus. That is in medical term what we call it as bilateral talipus. That is the baby's feet is turned downward and inward.
So you mean to say my baby's feet are in some abnormal position? There is some structural deformity.
Yeah, I mean to say the baby feet are down and inward, but this is a correctable conditions and it is not lethal. And most of the time, this may be an isolated finding, okay?
Mhm.
And with proper treatment and correct time at the correct intervention, the baby has works appropriately.
Mhm.
Okay. So what happens here? What generally what happens here is when let me take you to the management plans. So generally in this situation, what we will involve your baby, my consultant, even the baby specialist baby doctors, and also the physiotherapist of the baby and the baby surgeons also, and even the genetic counselor. So in this situation, what will refer you back to the baby specialist baby doctor so that he can again have a rescan done and we can so that we can rule out any other abnormality in the any other organs. Okay.
Right.
And if there is nothing found in the development of the other organs, that means and the baby is normal. In such situation, we'll be getting you connected to the baby doctor and the surgeons to discuss about the further treatment plan in the case of the baby.
Mhm.
Am I clear to you so far?
Yes. Okay.
So what they do once the baby is born, they generally manipulate the baby's feet to a feet by physiotherapy to a position, and they put some cast every 2 to 3 weekly for a period of around 5 to 8 weeks. Okay, and
Yes.
and after that. They put the baby is allowed to wear some special kinds of boots day in and out, even at the night time, and for a period of around 3 months, and after that only at night. Okay.
Oh,
Most of the time, we have seen such babies do work, and have sports, and they perform equally like other kids. Okay.
Yes.
So, and in case the baby doctors found like any other associated problem as with this condition, like any other abnormalities, in that case, the specialist doctor may also offer a special test, which is known as the needle test.
Okay.
Okay. So, do you want me to discuss about that?
Yes, all right.
So what happens in the needle test? It is done by the specialist. It is generally done under the ultrasound guidance by numbing the area on the womb, and a needle is passed and small amount of fluid is taken surrounding the baby, and this fluid is tested under microscope for any genetic abnormality in the baby. Okay. And if any genetic abnormality is found, you are left, it will always be your choice whether you want to continue or you want to terminate the pregnancy.
Okay. Yes.
Okay. So in case of in case you plan out whatever, if the baby is abnormal and we have a certain concern, like if the baby something abnormality comes out as the baby is 22 weeks, in that situation, and the baby termination has to be done by the specialist doctor, where they'll be injecting some medicines to block the baby's heartbeat, and only then the process of termination will be carried forward. Okay.
All right. Yes, yes.
Any other concerns want to discuss?
Do you think it is because of my fault?
Not at all. And there's nothing which you could have done or not done it. And it is the causes in this case is most of the time unknown. Okay. And sometimes we have seen it runs in families. So any members in your family affected with such condition?
No, no one. Hello? No family member is affected.
Okay. So any other concern?
No.
So I'll provide you the patient information leaflet, and we'll also get you connected with the specialist doctor, baby doctor, so that we can re-evaluate the scan of the baby. And I'll provide you information. I can also, if you want, make you visit some hospital where you can see how the treatment of this condition are done. And if the baby is born with talipus, the baby has to be get registered into a registry called national Anc cards.
Yes.
Also will help you with the support group called steps. Okay.
Yes, yes. That is the anomaly register. Yes. Okay. Fine.
Okay.
Thank you.
So,
You still have few seconds. Close the station. No problem.
yeah. So I'll provide you with the patient information leaflet, and also regarding the information in details about the talipus and the support groups, and I'll get back to you. Whatever is needed will be done further on. Okay.
All right. Yes. Okay. Thank you. Well done. Okay. I think you were a little hesitant in this station. Maybe I'm thinking like that. What do you say, Annie?
No, I was a bit hesitant.
You were a bit hesitant.
I was lost in between.
But you managed. You managed. All right. So in the exam, if the patient wants to know about the scan report first, discuss the scan report. There's no need of delaying it. Like, suppose you ask, okay, can I ask you a few questions first, or would you like to know about the scan report first? No, doctor, I'm concerned about the scan. So please discuss the scan. All right. So this is the scan, then go on. But here I wanted you to take my history. That was also absolutely fine. So you took the history. Because sometimes when you will
In
see,
targeted history, whatever I asked was sufficient, or we need to go further also?
No, that was sufficient. You are just discussing about the anomaly scan and brief targeted history, like it was absolutely fine. You don't have to complete the whole template. It was absolutely fine. You have to ask about any family history of concern, like any baby with any genetic problem, any problem in the feet. So Down syndrome screening test and all. Yes. Okay. All right, so she's Rose Parker. Rose, I understand you're 22 weeks in your pregnancy and you're here to discuss your scan report. Am I right? Is there any other concern and expectation from today's meeting? If she's very much worried in the exam in these anomaly stations, you can just echo and say, yes, I can see that you're so much worried and concerned about your scan report and your concerns are valid. Doctor, please discuss about the result first. Yes, I have your report right in front of me and I have confirmed your name, date of birth and NHS number. Do you have any idea about the report? As per the scan report, you are having a baby boy and the heart activity is seen. The water around the baby and after birth is normal and you're 22 weeks pregnant. Tell the good thing first, then you have some concerns. I have some concerns regarding your baby's feet. The scan is showing that the baby is having abnormality in feet, which is known as talipes or club foot in medical terms. Have you heard about it? All right, so what happens that normally the feet are in line with the legs, but in talipes, the feet are rotated downwards and inwards like this. If you're able to draw, you can draw the feet downwards and inwards, and this is known as the club foot. It is a mild abnormality, not lethal at all, and it can be corrected easily after birth. Exact cause is not known, and sometimes it can run in the family. Also, no other abnormality has been found in the baby. Am I clear so far? Any questions? Now, if she starts blaming herself, like you told very nicely, please don't blame yourself. It is not because you did or you did not do something, and treatment is also available for this condition. I'm sorry to give you this news, and I can see it is very upsetting for you. Can I continue? And like, if she's very absent in the exam, only then you can say these sentences. I can arrange another appointment. Would you like to call someone to be with you? So may I continue? All right. So in order to plan your further care, I would like to ask you a few questions to know more about you and your pregnancy, and hopefully we will come to a mutually safe and agreed care plan. Is that okay? So can you tell me, and here, yes, you can talk about giving the patient information leaflet about your condition as well. Can you tell me more about your pregnancy? How has been your pregnancy so far? Was it planned, spontaneous? How about the baby movements? What about your previous tests and scans and the Down syndrome screening test? Have you ever been pregnant before? So can you tell me more about those pregnancies and deliveries? How's your baby doing? Was it a normal delivery? Okay. And is your baby fit and well? So you have to ask about the previous baby also. Is he fit and well? May I know when was the last periods? And are you following GP for any medical condition? Are you on medication? Did you take folic acid? Any allergy? Anyone in the family with the same condition or any genetic problem? May I know, do you smoke, drink alcohol? Pardon me to ask, any recreational drugs? And may I know, what do you do for a living? Whom are you living with? Is your partner supportive? Is he fit and well? Have you been feeling low or down lately? May I know your blood group? Thanks for these informations. Would you like to add anything important? All right, so regarding your further care plan, it will be shared care involving my consultant, group of specialist doctors, baby surgeons, and specialist nurse. And most of the time, the condition is not associated with any abnormality in the baby, but sometimes there can be problem in other organs. Like there can be a gap in the baby's back, but that is very rare. And sometimes there can be problem in his baby's genetic makeup, but I can see that your Down syndrome screening test was normal. So we can refer you to a team of expert baby doctors, and they will offer detailed scan to assess your baby's other's organ if they have any concern. And then, if needed, they will offer you needle test to check for the baby's genetic makeup. Have you heard about the needle test? Would you like me to tell in details about it? Okay, then you are going to tell the needle test. She's 20 weeks, so you will discuss amniocentesis. So everything we discussed in other stations, important points in the needle test will be talking about the miscarriage. The risk is 1 in 200 procedures and there is risk of infection. And all measures will be taken to reduce these risks. Now, once the test results are available, we will arrange follow-up meeting. If results are normal, it will ensure baby is not having any problem. And like if everything is normal, then regarding the further care, You will be booked in consultant-led unit and provided the routine pregnancy antenatal care. So here I'm not repeating again the baby doctors and baby surgeons because I already talked here the group of specialists. So no need to repeat the same thing again. All right, now at every visit, what we have to do, check your blood pressure, urine for protein. We will aim for vaginal delivery. At the time of delivery, baby doctors, baby surgeons will be present, and your baby will be offered physiotherapy by physiotherapist. They will do gentle manipulation, casting of the baby's feet for a few days. Most of the time, the deformity gets corrected with these simple measures. So what happens? The template can get changed in the exam. If she wants to know in the very beginning, doctor, you said that deformity can be corrected. So how the deformity can be corrected? Then you can tell about all these things, that there will be baby doctors, baby surgeons, physiotherapist, and some massage will be done, some manipulation will be done, and this will help to correct the deformity. If deformity is still not corrected, we will offer minor surgery, which will be done by the expert baby surgeons. After the surgery, baby has to wear special shoes. Enough. Now, for how long the baby needs to wear the special shoes, no need for us. Baby will wear special shoes after the surgery. Okay, any questions? Now, if she insists and interrupts you in between, doctor, I want termination of pregnancy. It's too much for me. Yes, your concerns are valid. And I would like to tell you that whatever decision you will make, we are here to help and support you. Every woman has the right to make decision about their pregnancy, whether they want to continue it or not. May I know why do you want to have termination of pregnancy? I don't want to have a child with deformity. So I would like to tell you that it is a correctable deformity, and many babies lead a normal life after correction. So is it okay if we wait until the results of test is available? Because if results are normal, you can continue with the pregnancy. If not, then you can decide about having termination of pregnancy. Tell doctor, I want termination, how it will be done. All right. So in that case, as you're 22 weeks in your pregnancy, medication will be injected in the baby's heart to stop the baby's heartbeat and to make sure that baby is not born alive. So yes, we have to offer potassium chloride. And then we will offer some tablets and deliver your baby vaginally. And for this, we need 2 doctors to decide regarding termination of pregnancy. Okay, any questions? So here you can arrange next meeting with the consultant, specialist baby doctors. Bill, if you have given already in the beginning, no need to repeat. Give the support group's number, contact numbers for clinical access. And if she wants termination, then we have to see after a week time. Because when determination is done, normally 23 plus 6 weeks, right? So she's already 22 weeks. And so we have to call her as soon as possible and decide for termination of pregnancy as early as possible. Anything else in this station? Yes, you told a very nice point, Anita. If your child has club foot, your clinical team will register the details of this in rare disease registration service. You can say only this one also, that this is known as the NCARDs. Okay. And also you have the right to opt out of the register at any time. Fine. So we are done with today's session. Any question?
Ma'am,
I
ma'am,
have
in the sec-
One?
uh,
Yes. This
if
is
the for termination in this gestation age, can we mention about the surgical aspect also, ma'am, or medical method alone we have to discuss?
22 weeks. Like most of the time, the baby will deliver with this, isn't it?
Yes,
Is it
ma'am. But
possible?
in the patient decision aid, there are 2 things have been given, no, ma'am. After 14
Yes.
weeks, methods
Yes.
have been given.
Yes, you're right. So you can say that if medication methods will fail, then we can offer you this surgical method also. That will be your dilatation and evacuation.
So has to choose from that, or advantage and disadvantage like that we have to say about
Yeah.
medical method
If
method like
there's yes, if the station goes on that side, and if she wants to know about the details of the termination of pregnancy at this gestation age, then yes, you have to talk about the pros and cons of both the medical
and
method
before
and the terminal surgical method. And of
okay ma'am.
course, a potassium chloride is a must, because as far as I remember, from 21 plus 6, we have to give
Yes.
potassium
Okay.
chloride, right?
Okay.
Yes, there is an abortion guideline, the new one. I think it came in 2022, and very nice. They have the boxes. They have compared the medical and the surgical method of termination of pregnancy, the pros and cons. Anyone else has any question?
Yeah, if she asks that is it 100% correctable, then what would I say? What would be
Very
the answer?
difficult, right?
Yes.
100%, like we know nothing is 100%, but yes, most of the time it is correctable. And for that, like to get more information on that, we can refer you to the baby surgeons who like, because club food, they have what you say, um, the specialist who deal with the club food. So we can like you can have further discussion with the consultant, and also we can arrange appointment with the baby doctors and baby surgeons.
Yes. Okay.
Mhm. Anything 100% is a very, like, the question comes and it is very difficult to answer in the exam. We get
Yes.
blank. I know. Even it has happened with me. Anyone who has given the exam, they have become blank. No one can say that we answered all the questions. No one can say that. But yes, if you have to be little diplomatic, that suppose she asks any percentage, that what is the percentage of the cure in this case? So of course I don't know. So see, at the moment I'm not aware of the percentage, but I will discuss with my consultant and also the experts in this of this condition, and I will get back. You have to be honest, and you like if you will say this, they will be happy that okay, the
Or
doctor.
it depends on it varies from person to person. It depends on many factor. We can add like
Yes,
this type
you
of
can add.
sentences.
You can add.
Thank you.
Okay.
But I think it's a smart answer, because if someone doesn't know anything, at least we can keep ourselves safe, that we will discuss regarding it to our consultant, and then
Yes.
we will let you know it.
Exactly. This happens, isn't it? Not with the consult, but when we are doing the combined study or anything, we always ask that, what do you know this? Do you know this? So same thing is that I will ask someone and then I will get back to you. Best thing is your consultant, because you are behaving as a ST5 in the exam. Okay. Anything else? Anyone else? All right. So I will share the recording, and yes, this cystic fibrosis PDF I will edit and I will share in the group for you people. It has to be corrected. Okay. Thank you. Thanks for joining. Next will be ANC and Medicine Part 2. All right. Good night.
Thank you.
Okay.
Thank you.
Bye.